Thanks very much, Mr. Speaker. The Alberta's NDP caucus has heard from Albertans what they want from their healthcare system, and as we mentioned in the report, what people want, long-term care is a top concern. This government's move to close long-term care beds in favour of private assisted living facilities allows operators to charge outrageous fees for services that are covered under long-term care. Here's an example from one in Edmonton. If you need to be escorted to the dining room, $300 a month extra. $125 a month for help putting on your support stockings. $75 a month to get your bed sheets washed. Why is the Minister of Health closing long-term care beds in this province and forcing people into private facilities that gout?
Mr. Speaker, I'm not aware of any long-term care beds that are being closed. In fact, the opposite might be true, that not might be, but is true. We're actually looking at building more long-term care spaces. We have about 20,000 such spaces in Alberta today. We have about 9,000 acute care spaces. We need more. We have about 2,000 addiction treatment beds in this province, and we're working on increasing that as well. So it's really kind of the opposite to what the member is saying.
The honourable member.
Mr. Speaker, it's not kind of the opposite. In fact, many long-term care beds have been closed in this province since the last election, despite a previous promise to build 600 more. Here's some more costs. Incontinence management, $175 a month. Oxygen, $175 a month. Medication assistance, $200 a month. This is basic care, Mr. Minister, and public long-term care facilities do not charge extra for it. Why can't the Minister of Health see that forcing seniors to pay these kinds of fees for basic care could send grandparents to the poorhouse?
The honourable minister.
Mr. Speaker, we're going to be building more long-term care facilities. I think everybody knows that. The honourable member may have missed the announcement that there's a $100 million bond issue right now, and all of that money is going to go toward that. Plus, we have a long-term plan coming out on or about March 31st. It's called the Health Facilities Capital Plan. There will be, I anticipate, some additional good news announcements in that package of goods as well.
The honourable member.
Mr. Speaker, I want to be clear that this minister understands the difference between long-term care and assisted living, because we're talking about assisted living. And we released a report showing the government's plan to eliminate many of the long-term care beds in this province. Now, $300 a month for meal escorts, $150 a month for night checks, and $100 a month for a weekly bath is way too much for ordinary seniors and their families to be able to afford. So why won't the minister be clear that long-term care beds where these things are not charged for is in fact what the government is intending to build?
The honourable minister.
Well, Mr. Speaker, I'm sharply aware of some of the fundamental differences between long-term care and assisted living or daily assisted living or supported living or whatever. I know that under the long-term care arrangements, for example, we must have 24/7 supervision by a registered nurse, whereas in some of the other facilities, registered nurses might be on call but not necessarily staffed at the facility. Nonetheless, the issues that he has raised are those that are on the table for discussion right now.
The honourable